This is Shaana Wilson, your revolutionary therapist. I am here to continue this dialogue about this whole entire Change Healthcare shutdown. At this point, it's definitely a shutdown because we are nearing 30 days. It's been 25 days since 80% of healthcare providers have not been paid in the United States. So there's a lot of questions swirling about what's really going on. United Health Group, which is the conglomerate that owns Change Healthcare, is really working to make sure that their systems get back online tentatively for tomorrow, March 18th. So what that means is that they will be able to begin processing claims. But the question now is how will this process go down the pipeline with a backlog of claims for the last 25 days?
Ms. Wilson, why is this not in the mainstream media as far as, the news? Why is this not being discussed? I think this is very important for all the people out there.
That's such a great question because many providers right now are asking the same thing. And, what's really interesting about this is the news actually did cover a portion of this information. However, they really focus the narrative around pharmacies and prescriptions being impacted. Well, those have really quickly already been back online with Change Healthcare now for the last week. And so that leaves the lingering question regarding major hospitals, outpatient clinics, mental health offices, dental offices, you name it, anywhere where there is a health insurance transaction for a healthcare service has felt the ripple effects of this. Now, regarding what the media is choosing to cover or not choosing to cover, that's really unclear, but it does make my ears peak regarding the why it's not being talked about, which makes me wonder if there is something else that we possibly don't know about that could be happening. I always like to use the example that, a lot of circumstances are like the example of an iceberg. We see everything on the top, may just be a little piece of ice, but underneath there's this huge chunk of ice that's going on that no one else can see. And I think that this whole Change Healthcare situation is very much reflective of that.
Question number 2, how does this affect the day-to-day operations for a healthcare provider?
I'm so glad you asked this because this runs pretty deep. Healthcare providers accept health insurance for the majority of their services. You have entire practices that solely rely on health insurance reimbursement to run their operation and cover their expenses. So just kind of a quick narrative for the pathway of a claim. When you go to a doctor's office, you submit your health insurance card, and from there, their billing department or billing manager sends your claim based upon your insurance coverage to your health insurance company to get paid. But there's a really, really important middle person, and that middle person is a clearinghouse. And what a clearinghouse's job is to ensure that the transaction is up to standard and code for the healthcare transaction to be accurate. And so what the clearinghouse's role is to make sure that all of your information is correct, all of the health providers' information is correct. And then from there, the clearinghouse sends electronically all of the claim information to the insurance, and the insurance ensures that you get paid. But there's also a return process that the clearinghouse has. Once you are paid, it passes back through the clearinghouse again, and the clearinghouse gives the provider an invoice that says, we've paid you X, Y, and Z. So imagine that happening thousands of times per day. That's how important a clearinghouse is, because they are the wheelhouse to ensuring that a transaction for your insurance service is paid for, it's accurate, and it lets the provider know that the amount that they've paid has been reconciled and covered. So, what this disruption means is that none of this dialogue in technology, or none of these transaction in technology, is happening around finances for providers to be paid.
Question number 3. Okay. Are they providing any type of assistance for the providers out there? Because we all know that most of these providers are hurting. There was no backup plan. The cyber attack came out of nowhere. So please, can you emphasize what type of assistance are they offering you? United Healthcare or the federal government, if they're involved? Thank you.
So this is actually a really big frustration with health providers right now, because United Health Group, shortly after about 10 days when the cyber attack happened, they launched a loan program through Optum Bank. And what's really interesting about this is Optum Bank is a new bank that started in January of 2024. And so part of this package or offer that they provided for healthcare providers was basically you had to qualify and meet certain eligibility requirements. You had to be a provider that submitted claims to United Healthcare through Change Healthcare. And again, just to kind of explain this umbrella, United Healthcare is a private insurance company, and Change Healthcare, the conglomerate clearinghouse, actually is owned by United Health Group. So what Optum offered healthcare providers was eligibility based upon how many members per se you would see on a monthly basis, and then they calculated a number. But the number for the loan amount was it really was just insulting. I mean, I've heard colleagues share they were offered $10, $50, $240 was the highest amount I heard. And these are mega large hospitals and organizations that are getting these really low offers. So, in hindsight of the revenue that has been delayed for the average health provider's office, that those loan amounts wouldn't be a resource at all. Also, the United Health Group were also solicited by the government to, try to expedite payments, which they did continue payments for, some of the claims. But at one point, the government reached out to HHS, which is the Human Health Services Department, and they oversee Medicaid and Medicare services. And basically, they also offered an advanced program, which basically is you would qualify by being advanced a lump sum based upon, the claims that you have for 90 days in 2023. However, HHS backpedaled on that because they said it would potentially cause some downstream issues with taxes and ensuring that they would be able to recoup those funds back once everything was back to normal. So all in all, there really hasn't been anyone to step up. At this point, almost 30 days in, United Health Group hasn't provided any real assistance, and the government has not provided any real assistance either.